A stroke happens when blood flow to a part of the brain stops. A stroke is sometimes called a brain attack. Stroke symptoms. The symptoms of stroke depend on what part of the brain is damaged. In some cases, a person may not know that he or she has had a stroke. Symptoms usually develop suddenly and without warning. Or, symptoms may occur on and off for the first day or two. Symptoms are usually most severe when the stroke first happens, but they may slowly get worse. A headache may occur, especially if the stroke is caused by bleeding in the brain. The headache starts suddenly and may be severe, occurs when you are lying flat, wakes you up from sleep, gets worse when you change positions or when you bend, strain, or cough. Other symptoms depend on how severe the stroke is and what part of the brain is affected. Symptoms may include change in alertness, including sleepiness, unconsciousness, and coma. Changes in hearing, changes in taste, changes that affect touch and the ability to feel pain, pressure, or different temperatures, clumsiness, confusion or loss of memory, difficulty swallowing, difficulty writing or reading, dizziness or abnormal feeling of movement, vertigo, lack of control over the bladder or bowels, loss of balance, loss of coordination, muscle weakness in the face, arm, or leg, usually just on one side, numbness or tingling on one side of the body, personality, mood, or emotional changes, problems with eyesight, including decreased vision, double vision, or total loss of vision, trouble speaking or understanding others who are speaking, trouble walking. Stroke treatment. A stroke is a medical emergency. Immediate treatment can save lives and reduce disability. Call 911 or your local emergency number or seek urgent medical care at the first signs of a stroke. It is very important for people who are having stroke symptoms to get to a hospital as quickly as possible. If the stroke is caused by a blood clot, a clot-busting drug may be given to dissolve the clot. Most of the time, patients must reach a hospital within 3 hours after symptoms begin. Some people may be able to receive these drugs for up to 4 to 5 hours after symptoms begin. Treatment depends on how severe the stroke was and what caused it. Most people who have a stroke need to stay in a hospital. Treatment in the hospital. Clot-busting drugs, thrombolytic therapy, may be used if the stroke is caused by a blood clot. This medicine breaks up blood clots and helps bring back blood flow to the damaged area. However, not everyone can get this type of medicine. For these drugs to work, a person must be seen and treatment must begin within 3 hours and when the symptoms first started. A CT scan must be done to see whether the stroke is from a clot or from bleeding. If the stroke is caused by bleeding instead of clotting, clot-busting drugs, thrombolytics, can cause more bleeding. Other treatments depend on the cause of the stroke. Blood thinners such as heparin or warfarin, calmette, may be used to treat strokes due to blood clots. Aspirin or clopidogrel, Plavix, may also be used. Other medicine may be needed to control symptoms, such as high blood pressure. In some situations, a special stroke team and skilled radiologists may be able to use angiography to highlight the clogged blood vessel and open it up. If bleeding occurred, surgery is often needed to remove blood from around the brain and to fix damaged blood vessels. Surgery on the carotid artery may be needed. Nutrients and fluids may be needed, especially if the person has trouble swallowing. These may be given through a vein, intravenously, or a feeding tube in the stomach, gastrostomy tube. Swallowing trouble may be temporary or permanent. Physical therapy, occupational therapy, speech therapy, and swallowing therapy will all begin in the hospital. Long-term treatment. The goal of treatment after a stroke is to help the patient recover as much function as possible and prevent future strokes. The recovery time and need for long-term treatment is different for each person. Problems moving, thinking, and talking often improve in the weeks to months after a stroke. A number of people who admit a stroke will keep improving in the months or years after the stroke. Stroke is a common disease, yet every individual needs unique treatment and care. We encourage people with stroke and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about stroke and how to treat stroke, just click on the link at description or visit www.mainmd.com. Thank you.